Hello, everyone. Welcome back to Healthcare for Teens, a channel dedicated to helping teenagers understand more about the different areas of healthcare. Today, we have with us Dr. Richard Bach, one of the best cardiologists in the St. Louis area. Dr. Bach, thank you so much for being here with us today. I
Thank
want
you
to
for.
I want to start off by asking, what inspired you to become a cardiologist?
Well, there are a lot of different ways to practice medicine, and when you become a medical student and then start training in your residency, there's a lot of opportunities to see the different fields of medicine. And when I was in my residency, there were a lot of exciting developments, research, and exciting new treatments in cardiology. And, that's really what attracted me to the field. So it was really excitement in seeing how medicine could be practiced and how cardiology could be advancing ways of saving people's lives and helping them. So that's really how I got into cardiology.
And to be where you are today is certainly no small feat. What has your journey as a cardiologist looked like so far?
Okay, well, that depends on where you start the road. So it starts a way back. I was always excited about science in high school. Biology was my favorite subject, and I went into college majoring in biology and really with an intention to either go into research or medicine as a career goal. But I was pretty uncertain when I started college where that pathway would really take me. But really during my time I went to Georgetown University, and while I was there, I really just continued to love the sciences and biology. And when I graduated, I was fortunate to go to NYU Medical School, and medicine was very exciting. All of those steps really reinforced that I loved medicine and wanted to continue. And each step along the way. Then once medical school was finished, and I did a lot of research during my time in medical school, so I had a direction that I wanted to be a cardiologist who practiced in sort of a medical school setting. We call that academic medicine when you practice in a hospital that does teaching, teaches medical students, and does a lot of research. And that's kind of where I directed my career back at that point. And like I said earlier, it was during my residency that I got exposed to the specialty of cardiology, treating people with heart disease. And that takes doing a couple of extra years of training in what's called your fellowship. So when you finish residency, you then need to specialize if you want to go into a field that requires extra training. And that takes another additional 3 years of training to become a cardiologist after internal medicine residency. And then I found a job here in St. Louis. I come from New York, so this is not my roots, but I found a wonderful job here. First at St. Louis University, and then was brought over here to Washington University several years later. So I've been here now more than 20 years, and that's kind of the path that I took. But it all started back with a love of science and biology in high school, honestly.
Now that we know how you are where you are, I'd like to ask some general questions regarding the heart. What are
Sure.
the most common heart conditions?
Yeah, well, there's several common heart conditions, and unfortunately, just to mention it, heart disease is still the number one killer of people in our country. So it's not as if our treatments have made it go away. It's still a very common problem. Perhaps one of the most common problems is that you can develop what's called atherosclerosis, which is the buildup of plaque and blockages in your heart arteries. And that can affect not just the heart, that's also the root of conditions like stroke and blocked arteries to the legs. Those are sort of related conditions. But so heart artery blockages, and when it involves the heart, we call it coronary artery disease, one of the more common problems that a cardiologist will take care of a patient for and treat. And then there are other also relatively common heart problems. The heart can become weak When it does, that's called a cardiomyopathy, and patients who have weak hearts can develop a condition called heart failure, congestive heart failure. Patients need careful attention when they have that condition and medications to help them. And I run a center here for a more unusual condition called hypertrophic cardiomyopathy, which is a condition where the heart is thicker than normal. And even though it's very strong, those patients can have symptoms from their thick hearts as well. So those are just a few of the conditions. Many patients have heart rhythm problems, irregular rhythms, tachycardias, which are fast rhythms, and cardiologists who specialize in rhythm will often treat people with those kinds of heart problems.
And what are some symptoms of heart disease?
Yeah, the most common symptoms are chest pain. Now there's, particular kind of chest pain that comes from the heart. Your chest has a lot of different structures, and so you can have chest pain for a lot of different reasons. But discomfort that comes when the heart is not getting enough blood flow, for instance, or it's struggling or straining, that's a common symptom that people may develop, and that may be a warning that they're in trouble from this problem with heart artery blockages. Shortness of breath, either when someone is just resting and they start to feel short of breath, or more commonly, if they try to do things, it always makes them easily winded. That's another common symptom, and in fact, probably the most common symptom when someone has this condition called heart failure. And the third most common symptom is probably what we call palpitations, which is a feeling of irregular heart rhythm or heartbeats. Feels like you might be skipping a beat or that your heart's racing. That's called a palpitation or palpitations, and many people have that as a symptom.
We know that eating and exercise habits are pretty important for good heart health, but how much of an impact do they really have?
It has a big impact. We sort of know that from some important studies that were done probably more than 30 years ago now, but individuals living in one part of the world who moved to the United States and adopted a Western diet, for instance, they had a much higher incidence of developing heart artery blockages than the individuals in their native country who followed their more typical diet, which was usually, fish and vegetable based rather than meat and dairy based. So we do know that diet has an impact on the risk of developing particularly heart artery blockages as a problem, and modifying your diet so that it doesn't have a high intake of fat and cholesterol can be really important in helping to prevent those problems from developing. And frankly, those problems develop much later in life, but they take decades to become significant and end up causing clinical problems. So even the habits you develop when you're in high school or young can have an impact on what happens later in life. And then exercise, you bring up exercise, it's a great thing to, pursue, because exercise has been well shown to prevent heart artery problems and heart disease. If it's pursued, it can help reduce blood pressure for people who might be at risk for having high blood pressure. And being physically fit has an impact on, your longevity, how long you're able to live, and probably mostly because it has an impact on heart health.
And how do genetics affect heart health?
Genetics have another big influence. We're just for the last 20 years, we've had a lot of research done in genetics, and genetics have a very big impact on your level of cholesterol, your risk of having heart artery disease. Some of these conditions I mentioned have a genetic predisposition. It's uncommon that they're being caused by, for instance, a single gene causing a condition. More often, the genetic influences of perhaps one or more genes, but along with your lifestyle habits like diet, exercise, all those things get together to cause you to have a higher or lower risk of developing heart artery or heart disease when you get older. But genetics and what we call the environment, which are those lifestyle issues, both have big impacts on an individual and whether or not they will or won't have heart disease later in life.
And for conditions such as heart attacks and cardiac arrest, what are some common treatments?
Well, first of all, cardiac arrest, which happens. Luckily, it doesn't happen all the time and not frequently to most individuals. But for someone who has, cardiac arrest, individuals nearby who know CPR can be lifesavers. So it is something that's worth learning. The American Heart Association has ways that individuals can learn CPR, and thereby, if someone in a crowded place or in a public area, airport, wherever, were to collapse, you can really make a big difference in saving their lives. So CPR is an intervention for someone having a cardiac arrest that can actually just be life-saving. And even, one of us, along with that person, can help keep them alive until the EMS arrives, the paramedics arrive, and can take that patient to the hospital to help save their life. We know a lot about how to conduct CPR now. So when patients get to the hospital after they've had a cardiac arrest, there are treatments we can provide that can help them both recover and save their life. So probably more than sophisticated things than we can discuss right now. The other topic, the heart attacks. So we've made a lot of advances in treating heart attacks. And just to mention it, a heart attack refers to an individual typically with that problem of plaques in their heart arteries developing a sudden blockage of that heart artery. When the heart, which needs blood flow all the time, develops a blockage that stops the blood flow, that's when the heart is getting damaged. Because the heart needs so much blood flow, it's getting damaged very quickly. So the person is generally having chest pain. They may be having shortness of breath and be in trouble. Without rapid treatment, the heart may die very quickly, and patients may die at a high rate from a heart attack. But these days, patients get treated very quickly by cardiologists that are called interventional cardiologists. Patients are taken to the cardiac cath lab, and they get a procedure to open up the blocked heart artery. And very quickly, that stabilizes the situation. So those advances that are within the last 20 years, that's become routine, mean that heart attacks now can be stopped very quickly, and those patients can recover and really do very well compared to, even just a couple of decades ago, patients were dying more frequently or ending up disabled after a heart attack. So we have good treatments now, good procedures. They used to be called angioplasty. We now call that a coronary intervention when a patient has a blockage opened. And good tools called stents that open up blockages in heart arteries that we now use very routinely to treat people with those conditions.
And how can people help, whether that be donating to an organization or something else?
That's a great question because, there's still a lot that needs to be learned and a lot of advances that we need to make in the treatment of heart disease. And there are a couple of organizations, but the most prominent one that I admire and work for as a volunteer is the American Heart Association. There is a local American Heart Association office. They're always looking for donations to help them succeed at their mission. And their mission is to really get out into the community, help people improve their lifestyles, promote education in healthy lifestyles, blood pressure control, all of those important things that we were talked about that can help prevent heart disease. So contributions to the American Heart Association or even volunteering for the American Heart Association, I would recommend that. You may see in the news, it's in the spring, but there's something called the Heart Walk, which raises money for the American Heart Association. I would encourage all of your listeners to participate. It's a fun event. You walk, sometimes it's at the Cardinal Stadium downtown. Sometimes it's in other locations. You just have to look when it comes. I think it's in the spring. But that's a great event that you can raise awareness for heart problems, heart disease, and contribute to advancing research by contributing to the money raised by that event.
And last but not least, what advice do you have for young people that aspire to become medical professionals like you?
Yeah, I can't say enough that this is an exciting career. I think that anyone who's interested in science, who is interested in helping individuals, helping patients, especially in their times of need when they're very sick, medicine is a very fulfilling and exciting field to get into. It does take a lot of work at school. Work hard, learn your topics, learn your subjects. Don't just focus on one topic because most medical schools want well-rounded students, but just realize that working hard at school will have a tangible benefit and pay off if you're interested in medicine, and it's a very exciting field. So I think if you have those interests in high school at this point, don't hold back, pursue them, and see if, like me, you feel that's exciting and worthwhile. And getting into medical school is not necessarily easy, but it's worth the giving it a try if that's your interest and that's your goal.
That's it for this video. And Dr. Bach, thank you so much for the opportunity to interview you.
Happy, I appreciate you inviting me. Thanks so much. Great talking with you today.